Well, hello, everyone. My name is Justin Scheitzer, and thanks so much for joining me here in the exhibit hall at Eyes on Glaucoma 2023. It is my distinct pleasure and honor to be joined today for a short but very informative interview with Dr. Toby Tyson. Toby, I really want to thank you for taking time out of your day to join me to be a part of this. And please tell us a little bit about yourself. Tell us a little bit about your practice as well.
Well, thank you, Justin. It's a pleasure to be here. I practice down in Southwest Florida. I'm a cataract, refractive, and glaucoma surgeon. And our practice has multiple locations with ODs and MDs. We've got glaucoma, retina, cornea, and a lot of cataracts. So, when we've been looking at the different devices, having the flexibility where it can work with a lot of different users and technicians has been really very beneficial.
Well, I'm excited to have you here today as we're going to be talking about the iCare Compass. And so I'm going to throw a lot of questions at you. I know our audience is excited to hear about this technology as well. And so I think the first, logical question to ask you is, how often is the iCare Compass utilized in your practice? And really for what kind of patients do you utilize it for?
Well, when we first started out, we had the iCare Aiden camera. And that was a wonderful device. And we opened up a new satellite office. And so when we look at the actually equipping that satellite office, it was like, well, we know that we need to have a visual field machine. We love the Aiden camera, and the ability to merge the two into one made a lot of sense because one, it allowed us to have one device that could do multiple things. It was less square footage that was being utilized. And the ease of use was another factor. So we brought it in, put it in that satellite office, and it was being utilized, yes, as a visual field machine for our glaucoma patients, but it was also being used kind of like a gateway to our patients coming into the practice. So every new patient that was walking through was getting a fundus photo on the Compass. In addition, all of the cataract consults that were coming through were getting fundus photos, because not only could you see a lot more probably than just with using the 90 diopter lens at the slit lamp, especially the fact that you could go through a 2mm pupil, but it was real color. So it was what you were expecting to see. But one of the side benefits was the technology seemed to actually enhance the visibility of epiretinal membranes. So when there was pathology back there, it wasn't being overlooked, it was actually being highlighted, and that helped us stay out of trouble, especially on our premium cataract patients. But then being able to also do visual fields for our glaucoma patients and any of the ones that might be being evaluated for pituitary tumors or other visual field defects, it really allowed us to have that flexibility.
So just to kind of add on to that and for our audience, because when we think of a lot of technology, some are used for screening, some are used for monitoring diseases, those types of things. So when you think of the Compass and the way that you're utilizing it, is this being used more for screening, or are you characterizing it and using it more to monitor disease progression or disease state in your practice?
Well, the nice thing is it's being used for both. Some people in the past would have a real super duper high-end camera that was just being used for disease, and then they would have a cheapie to be able to use at the front door. This camera has the quality of imaging that rivals anything else out on the market, but the ease of use allows it to be used in a screening capacity. So we're using it as a screener, but we're also using it to monitor disease progression. And so I think it's a kind of a nice jack of all trades.
Well, thanks for that information, Dr. Tyson. So as we think about other perimeters on the market that our audience may be familiar with, how would you compare the Compass to those types of perimeters?
Well, I've been doing perimetry since I was in high school as a COT. And so I remember the good old days where you'd put them in the fishbowl and you'd sit there and log all the data points, and the patient would start snoozing off because it took so long. And you really weren't sure exactly where you were actually getting the information. And what I mean is there wasn't a good registration system. Yes, they would go and check and see if they could see in the optic nerve area in the physiologic blind spot. So it would check to see if they were theoretically cheating. But now with this technology, you actually are able to have a registration so the device knows which area it's testing. And I think that reproducibility really aids in, one, accuracy, two, disease progression, because now when you have a change, you know that it really exists where it is. It's not some artifact of testing. So I think that's very important. The other thing is the ease of use for the patient. A lot of people have now gone to the headsets. The headsets with a lot of my elderly patients, they are hard to balance. The patients fatigue out on them, where this has a chin rest, but also the software is very easy. And the patients really know if they saw this or not, because the device is actually highlighting the retina, not a reflective surface that they have to then visualize. So it's a little bit more direct. So I find that the patients do much better on the machine. They don't fatigue out. And really the technicians, it allows me to utilize a much broader range of technician to operate the device and work with the patient than with some of the other systems that are on the market.
Yeah, and accuracy is so important. So I'm glad you touched on that and explained that, because if we're not getting accurate test results with any technology, then it's kind of useless. And you kind of alluded to this, and I think I already know your answer, but do you find that the tracking capability provides more accurate results over time?
Well, we've had ours probably about 2 years to 3 years. So we don't have as much data to look at on a 5-10 year progression. But my gut instinct says, yes, if you're taking the test more reliably, then we're going to be able to see that progression much sooner, because it's going to actually stand out sooner in a fashion that we believe and trust is true and accurate.
At the beginning of our discussion, you had kind of touched a little bit on the color imaging capabilities. And so I want to go back to that and just ask a question around this. So how does the color imaging capabilities, of Compass aid in monitoring the optic nerve head?
Well, one, we're used to seeing in color, and some of your competition likes to be with 4 colors. And I think you're missing out. Color adds information. And so when you're looking at optic nerves, it's not just trying to infer 3-dimensionality by how vessels curve or don't curve, but also having the pallor and being able to notice that really lets us know the health of the optic nerve. So I think having the color ability makes a really big difference. It was one of our driving decisions in buying this technology over some of the competitors that were only using 4 colors.
I love the tidbit earlier of that you in your high school days were a COT. I had no idea. So that's great information. That leads me to really into my last question, because very similar to your practice, we have a bunch of COTs, COAs, technicians that are running a variety of different tests. And so I guess my question in closing here is, do you find that the iCare Compass's automation allows really anyone in your practice to be able to perform the visual field and to get a photo?
Well, actually, it's the starter diagnostic that we actually train our staff on. So when they first come in and they don't have any ophthalmic or optometric training, they're getting started learning how to run the Compass, because it's a device that is so user-friendly that with their limited initial skill set, they're able to master very quickly. We know that the results that they're getting is reliable. And as they improve their skills in the clinic and get their certifications, we then branch them out to other devices that require a little bit more user interaction and understanding.
Well, I want to thank everyone that's joined us for Eyes on Glaucoma 2023 that took the time to join us here in the exhibit hall for this particular interview on the iCare Compass. Dr. Tyson, I want to thank you for taking time out of your busy schedule to spend it with me and providing such a wonderful wealth of knowledge around this technology. I know I learned something today, so I really appreciate you.
Thank you very much. It's been a pleasure.